Welcome to British BioMedicine Institute. Today I, Dr. Pramod Khatri, is going to represent a simple topic on hemostasis. So hemostasis is a combination of two words, hem, blood, and stasis is to stop. So basically it is a process of forming clots on the wall of damaged blood vessels and preventing blood loss while maintaining blood in a fluid state with the vascular system. If there is a defect in hemostasis, that can lead to increased risk of bleeding such as hemorrhage or clotting like thrombosis. So there are basically four stages for the hemostasis. First one is vascular constriction. Second is formation of platelet plug. Third is formation of blood clot, and fourth is fibrinolysis. So the events in the hemostasis are, there will be a vascular constrictions which will constrict the damaged blood vessels, and there will be formation of platelet plugs where platelet will adhere to damaged endotheliums to form platelet plugs, and it is basically a primary hemostasis. Next is blood coagulation. A clot will form upon the conversion of fibrinogen in fibrin and its addition to the platelet plug, and that is known as secondary hemostasis. So the primary hemostasis can be basically divided into two stages. In the first stage, there will be platelet addition, platelet activation, and platelet aggregation. So through this picture, it is clearly visible that RBC cells will be stuck in the blood clotted area where collagen fibers and damaged endotheliums have already been activated, and your RBC cells, they will stuck and they will help in clotting the blood. In the next photo, it is clearly visible that various intrinsic and extrinsic pathways have already activated, and the ADP, serotonin, and thromboxane A2, they have activated, and they are now constricting, or they are engulfing, or they are constricting or engulfing the RBC cells so that they can get entrapped and blood coagulation can form. So now in the third picture, platelet plug has already formed, and it is due to the intrinsic pathway of the blood clotting which has resulted here. And in the secondary hemostasis, if there is a large hole in the blood vessels, a blood clot is additionally required. In the cascade of reactions, it states that inactive enzymes, they will be activated, and the activated enzymes, they in turn activate other inactive enzymes, which finally until the final step is reached. So basically here both intrinsic and extrinsic pathway, they play an important and major role in blood clotting. So there are various tissue factors or clotting factors, and with the help of fibrinogen and with the help of intrinsic or extrinsic pathway, various tissue factors, they get activated, like in intrinsic there are collagen fibers along with factor 12, factor 11, factor 9, and factor 8. And from extrinsic pathway, where there will be tissue thromboplastin, factor 7 will help, and it will lead to formation of factor 10, which will then convert prothrombin into thrombin, and fibrinogen will lead to the conversion into fibrin, which ultimately helps in clotting of the blood. Next is fibrinolytic phase. The fibrinolytic phase system does not allow the fibrin clot to grow and block a vessels, which would cause serious complications. The dissolution of a clot called fibrinolysis, where there will be dissolving of fibrin fibers, is brought back by the formation of active enzyme plasmin from plasminogen. So homeostasis basically depends upon vessel wall integrity, proper function of fibrinolytic pathways, adequate level of clotting factors, and proper functioning of platelets adequate number of platelets. So what cause bleeding disorders? If there are any type of blood vessel defect, any platelet disorders or any factor deficiencies, all these 3 points, they can lead to bleeding disorders. So basically bleeding disorders are inherited disease which basically comes from father to child, like your hemophilia. So we have various methods to study. The hemostatic function test can be studied with the help of bleeding time, clotting time, prothrombin time, partial prothrombin time and thrombin time. So these are the various steps through which we can study the hemostatic function of the bleeding time. So if the bleeding time and CT are two simple tests that are used as a routine before every minor or major surgery, like for example tooth extraction, biopsy surgery, before or during anticoagulants therapy, whether or not there is a history of bleeding. So now comes the bleeding time or BT. BT is the time interval between the skin puncture and spontaneous, unassisted, without pressure stoppage of bleeding. The BT test is an in vitro test for platelet functions. The main purpose of bleeding time is to detect the quantitative defect of platelets. The normal bleeding time varies between 1.1 to 6 minutes. So there is a medical application for bleeding time. If the prolongation of bleeding time increases, it may be due to defect in blood vessels, decreased number of platelets like thrombocytopenia. There can be a defect in the function of platelet caused by drugs like NSAIDs, aspirin, anticoagulants, sulfonamide and diuretics. And there can be an inherited disease also like hemophilia or like VWD, von Willebrand disease. So in the bleeding time, in the bleeding time we use various methods and materials like lancet, stopwatch, circular filter paper and alcohol. With the help of these material we can easily check the bleeding time. So in the bleeding time we will be using a disposable lancet to make a cut in the finger. A stopwatch is started immediately and every 30 seconds filter paper will be used to draw off the blood. The time from when the incision is made until all the bleeding has stopped is called as bleeding time. The filter paper should not be touched to the edge of the clot, as this may disturb the formation of platelet plug. The test is finished when bleeding has stopped completely. Count the number of blood spots and express your result in minutes and seconds. So in this way we can test the bleeding time in a patient. So next is prothrombin time. It will helps in measuring the effectiveness of extrinsic pathway. The normal ratio varies between 0.9 to 1.2, whereas PTT, partial thromboplastin time, measures the effectiveness of intrinsic pathway and common pathway, and the normal ranges or values are 25 to 35 seconds. Next is TT, thrombin time, the time to clot formation after addition of thrombin to citrated blood. The normal values or time ranges between or less than 15 seconds. So next is CT, clotting time or coagulation time. It is the time interval between the entry of blood into the glass capillary tube or a syringe and formation of fibrin threads. The normal clotting time is 3 to 6 minutes. Prolonged clotting time is due to severe deficiency of any coagulation proteins. Weak fiber clot called Febrile clots are known as hyperfibrinogenemia, and for this we need a method known as capillary tube method. The material we use for capillary methods are sterile disposable pricking lancet, stopwatch, dry capillary tube, cotton swab, and 70% of ethyl alcohol. So the method here is, we have to clean our finger with alcohol, prick the finger by lancet, and note the time using a stopwatch. Load a capillary tube for at least half full. After about 2 minutes, take the loaded capillary tube between your thumb and forefinger and gently break in half. Slowly put the end part to see the insoluble fibrin strands. Do a break every 30 seconds, and once the clot is formed, we record the time. The clotting of blood with this method involves both intrinsic and extrinsic pathways. There is an injury in the blood coming in contact with glasses, intrinsic pathway, and injury to the tissue, then we have to check for extrinsic pathway. The coagulation time can be increased with the help of following conditions like hemophilias, VWD, von Willebrand disease, afibrinogenemia and dysfibrinogenemia, vitamin K deficiency. It acts a cofactor in the synthesis of prothrombin and factor 8, 9 and 10. If a patient is having liver disease, then it can be increased, coagulation time can increase. Anticoagulant therapy, patient receiving heparin or warfarin show an increased coagulation time. Newborn babies. Newborn, especially premature babies, sometimes have a tendency to bleed because the plasma level of certain factors are low in newborn babies. So I hope you have gained a lot of clinical information through this presentation. Please like, share, comment our YouTube channel named as British Biomedicine Institute. Goodbye.